Most Americans get their healthcare insurance from private insurers. More than half of the coverage is employer provided. But millions of workers laid off during the pandemic have lost their coverage. And given the exorbitant prices charged by U.S. hospitals, many are shying away from seeking medical care.
And people do tell us they choose not to come in or wait to come in until they absolutely have to. And it often makes a condition that would be more easily handled, it turns into a chronic condition. Their deductibles are so high, their copays are so high, or with each visit, that they have chosen to eat and pay rent and their mortgage rather than seek medical care.
A study published by the National Nurses United looked at data from hundreds of hospitals across the nation and found that for every $100 of spending incurred by hospitals, they charge patients anywhere from $400 up to, in some cases, $1,800. Experts say there needs to be transparency when it comes to determining medical costs in the U.S.
Typically, hospitals in every state will bargain it with insurers in every state. I would say that it's really the disaggregated system in the US and the lack of price transparency in the US really kind of is probably the main contributing factor.
This graph shows national hospital expenditures rising from $393 billion in 1999 to nearly $1.2 trillion in 2018, close to 6% of the entire national GDP. And a similar trend is seen on this graph depicting the dramatic rise in U.S. hospital profits or net income jumping from about $16 billion to more than $83 billion in 20 years. The lack of transparency in determining healthcare costs is nothing new in the United States, but the need for a comprehensive healthcare coverage for everyone has never been felt as much as now during the pandemic, and that has brought some momentum to the public debate around universal healthcare. Two-thirds of people who file for bankruptcy cite medical issues as a key contributor.
The system was never set up to take care of everyone. So now that it is being asked to take care of everyone, it is not capable of taking care of everyone.
I don't get benefits through my work, and while I'm lucky to still be under my parents' coverage, I have friends who don't have that, and they're forced to rely on Medicare or Medi-Cal and basically know that they have to stay healthy at all costs.
The coronavirus pandemic has created far-reaching medical implications for everyone. And the lessons learned this year will likely shape the political debate around healthcare for years to come. It is Tian Shan, CGTN, Los Angeles.